Late last week, before Donald Trump illegally bombed Iran,
they don't know what the they're doing,
potentially dragging us into another endless war, his administration was busy conducting their favorite endless war, class war, by kicking 1 million people off Obamacare. On Friday, the Department of Health and Human Services, run by noted brainworm host Robert F. Kennedy Jr., made a number of changes to the Affordable Care Act to make it harder to get coverage. 68,000 Americans die every year because they can't afford healthcare, and yes, the government is actively working to increase that number. Trump's team changed a slew of rules to limit who can get coverage in the Obamacare marketplace and when they can get it. Specifically, they narrowed the window of time people have to sign up from 11 weeks to 9 weeks. They ended a monthly opportunity for lower-income workers to get coverage in the marketplace started by Biden. They limited plans' ability to cover gender-affirming care, and they excluded dreamers from obtaining coverage at all. According to its own projections, these rule changes will leave at least 700,000 people without health care, but that number could reach 1.5 million. These changes are temporary for now, but Republicans in Congress are pushing to make them permanent. They want to include them in Trump's big, beautiful bill, a massive tax cut for the wealthy and big corporations, paid for by cuts to Medicaid and food stamps and more debt. That would make these rule changes permanent and much harder for any future administration to change. Now, this story highlights two important things. One, Trump is doing exactly what progressives warned he would do with his war on Iran. It's a distraction. He knows the mainstream media can only focus on one story at a time, so all the other horrific things his administration is doing fall by the wayside. Stories like this, or that ICE is defying a court order to keep Xiomara Abrego Garcia in jail, or that Trump's in the FBI files on Jeffrey Epstein, are all forgotten when 40,000 American troops in the Middle East come under attack. And two, the Republican Party is waging a very real war against the working class in the United States. Let me explain. In this country, there are really just two classes. The ruling class, people so wealthy they don't need to work, they use their money to make more money. And the working class, the rest of us, people who have to sell our labor to survive. You can call the first group the 1%, the oligarchy, the capitalist class, or as Marx put it, the bourgeoisie, but whatever name you use, the reality is the same. They rely on our labor to create their wealth. But here's the thing, late-stage capitalism doesn't just want to make some money, it values making the most money possible. And to do that, they have to keep workers desperate by paying them as little as they can for as much work they can get. And that's class war. It's not fought with tanks or troops or outright physical violence, at least not most of the time, but it's very real, and it's why everyone's life is so much harder than it has to be, because the people at the top are hoarding what is rightfully everybody's. That's the real reason why Republicans have been waging war on healthcare. If your healthcare is tied to your job, you're less likely to leave that job or strike or organize or challenge the system. Because doing any of those things doesn't just risk losing your paycheck, it could literally kill you and your family. Capitalists need an army of desperate workers to keep their costs low and profits high. Cutting Obamacare keeps workers one illness away from bankruptcy, and that's on purpose. It's not about saving money, it's about maintaining leverage. But that's not the only reason Republicans want to gut American workers' access to healthcare. This hellish phase of capitalism we're in, neoliberalism, isn't just about shrinking government, it's about turning public goods into private markets. When the government guts access to public insurance, private insurers win. Companies like United Health, Aetna, and Cigna profit when people are pushed into worse plans or no plan at all because desperation equals dollars. Cutting Obamacare isn't a mistake, it's a transfer of power from public to private hands. And these cuts serve one other huge purpose: divide and conquer. Look at who gets hit hardest by these cuts: trans people, undocumented immigrants, and low-income workers who are disproportionately black and brown. All people the ruling class want you to blame for our terrible economy, not the exploitative system that makes them richer as we get poorer. This isn't an accident. It's strategic fragmentation. Cut a program that helps everyone, but especially marginalized people, and then tell the public those people are the problem. We need to stop thinking of these as isolated incidents. Trump's cuts to Obamacare aren't just about policy or small government, it's about control. We need a total shift in the way we think about this, and we have to fight back, not just with outrage, but with solidarity. Because the real divide in this country isn't left versus right, it's top versus bottom. And until we come together and recognize who the real enemy is, we're going to keep losing this class war. For Notice News, I'm Andrew Springer.